Okay, we're going to do two concepts here. We're going to do slips, trips, and falls. And this is where we're going to start overlapping the safety issues and fatigue with the sort of the chronic side of the equation, which people tend to silo ergonomics as being a chronic issue, repetitive exposures and stress and so on, with its own entity as ergonomics, and then safety as safety in its own entity. So I'm going to try to show you where some of this crossover is in this lecture. So slips, trips, and falls are distinct from each other. And we're going to talk about the basic mechanics of slips, trips, and falls. There are some regulations out there. And you see a lot of it on campus, around campus, with the rugs that you come indoors and outdoors, especially during the off-season, where we have snow and ice and things of that nature. And so those rugs are meant to capture a lot of that as you come in the door, so you don't track it up on the tile and slip and fall. There are ABCs of fall protection that we'll talk about, and we're going to have some of the aspects of fall protection equipment listed in here as well. We won't do a hands-on because of time. So to start out with, slips, trips, and falls are costly. Obviously, to the worker, there's some pain involved depending upon how the person fell. They're going to lose wages if there's time away from work. Temporary or permanent disability. Reduced quality of life, especially if it's a chronic thing. And the person can get depressed when they don't when they're not able to go back to work and earn a living. To the employer, there's obviously loss in productivity in business. There's also increased industrial insurance premiums and costs associated with training replacement workers. All those come into play. In terms of slips, trips, and falls, 15%, I'll hold you responsible for this, of all accident deaths, about 12,000 per year, to second leading cause behind motor vehicles. So we have to take this very seriously in terms of falling. As the population ages up, fatal falls are becoming more on the radar, mostly because if you get into the mechanics of movement, slips, trips, and falls, one of the key things that works in your benefit that is not in mine, a little bit more in mine perhaps than some people my age, is the weakening of the quadriceps femoralis, basically this muscle group right here in the thigh. And as you probably experience, if you hit something or you trip on something, what happens is that you have enough strength to shoot your leg out and capture your fall so that you go down but you come back up again. And I think some of you have probably experienced that. When you get older, this muscle is weaker on either side, and if you hit a trip, that muscle is not fast enough and strong enough to shoot out and capture you before you go down. As a result of that, you just fall forward and you usually tumble. Usually catch yourself at your elbows, break your forearms, usually the radius, the ulna, or sometimes your clavicle because of the shock of the type of fall that you have. And usually it's never symmetrical, right? It's usually asymmetrical. One of the things that they're trying to do for older people is teach them how to fall. And the idea is if you trip, and of course you have to practice this, is that instead of going straight down, you actually tumble, you roll into the fall. And it looks weird, but if you can roll out that fall, you dissipate that energy and you can come back up again. It's pretty neat if you see a 90-year-old pulling that off. But that's some of the training that's going on out there. One of the most frequent types of reported injuries, 25%, are in the claims every fiscal year for slips, trips, and falls. 17% of this disabling work injuries result in falls specifically. So types of injuries. Strains and sprains, know the difference between the two in terms of tearing tissue and not tearing tissue. We'll get into that a little bit later, but I'd circle that next to Dr. M is going to test me on knowing the difference between a strain and a sprain. Okay? Just know one is with tearing of tissue, just like kinesiology and kinetics. I want you to know the difference that in terms of forces. Same thing here. You should know the difference. Contusions and bruises, these are basically impact kinds of injuries. Fractures, of course, abrasions and lacerations that come into play. Commonly affected parts are pretty much all over the body. The knee, ankle, feet, wrist and elbow, back, shoulder, hip, all the way up, and the head. The head is particularly bad for slips, right? Especially when you see people slip and they go back and they fall, depending on how they fall. A lot of times if you can land on your gluteus maximus muscles, that's okay. But a lot of times some people don't. They fall straight on their back. And what happens, they have a whiplash and their head bangs off the floor. And usually what happens there a lot of times is that that really hurts. You're stunned from the whole thing, but realize the acceleration, deceleration of the brain, and a lot of times there can be a concussion involved, but sometimes internal bleeding, and there are some that have actually fallen and hit their head hard enough that started bleeding internally, and they died a few hours later. So it appeared like they get up, they're fine, and the next thing you know, they're dead because of the internal bleeding that they didn't know about until it was too late. So there are definitions between slips, trips, and falls. I'll hold you responsible for them. So when there's too little friction or traction between your feet and the walking surface, you lose your balance. So that's a slip. A trip is when the lower leg hits an object or your upper body continues moving forward, throwing you off. So basically, you feel that that's a friction element, where the other one is a lack of friction. Or when you step down unexpectedly, this is a fall. Or lose your balance stepping off a curb. And this occurs when, of course, you're too far off your center of balance. And so your slip is too little friction. The trip is too much friction. And a fall can occur from either a step down at different levels or on the same surface. Okay, so know the distinction between those. Two types of falls, same level, as I mentioned, lower level. When you fall at the same level, you're standing or walking, and you fall against an object or above a surface, or when you fall off a level, example, steps or stairs, ladders, platforms, and so on, all come into play. And it's usually a fall of about 10 feet or greater is usually result in serious injury. Now, it's not to say that a fall of less than that is going to be less serious, but it's enough of where the gravity comes in and you fall, and the impact as such, or the deceleration, is to cause serious harm. Here's actually some pictures of a student project a couple of years ago from student projects in terms of layout. You can see these mats right here, and then you see the slick floor, the tile. So think about changing the texture of a surface and what's called the slip resistance of a surface, where one, you've got basically good coefficient of friction. We'll get into that a little bit. And then that coefficient of friction is reduced, and then it's brought back again, and it's all within about 10 feet or so. So look at this right here. It's something that's set up to really throw you off. Let's say you're carrying your books, you're not really paying much attention, you're feeling the surface, and your body senses, the proprioceptors feel and sense that coefficient of friction. And then it changes. It goes from here to here. The problem is that sometimes if these floors are wet right here, now you really have reduced that coefficient of friction, moving closer to 0. By the way, it's from 0 to 1 when we do coefficient of friction. Write that down because you'll be tested on it. And then the idea is that here we have a fairly high coefficient of friction. I would say we're probably around 0.8, 0.9, somewhere around there. We go down to about maybe 0.5 right here, maybe certainly much less if it's slick. And this would be like today. It's raining outside. And then we hit this carpet again on the other side, and now we've gone back. By changing this in such a short distance, it's a recipe for failure in terms of you tripping on one end or slipping on the other. So the highly polished floors, marble, terrazzo, ceramic tile, and so on, or freshly waxed surfaces. This used to be a major problem some years ago, because a lot of people like to shine. So if you look at these floors right here, again, I'm really proud to teach here at Purdue. When I bring people from outside, they just are amazed at how well kept Purdue is. But you look at the shininess, and you want to see that because it represents being clean. But the problem is the older waxes, a shiny surface meant a slippery floor. And that really didn't work out very well, especially for the women who had a much smaller contact area because they would tend to wear high heels or pumps rather than flat-soled shoes. Or they would wear leather, for example, which is much more slippery than a rubber-soled shoe. So as a result of that, there were a lot of slips and falls. So the Johnson's Wax and others got together, and they came up with a formula as to how do we make it shiny, but still give it enough tacky resistance so that we have a good coefficient of friction. And most of these tile floors now are around 0.5 in terms of resistance. Changes, of course, in elevation. are problematic. Even these thresholds right here become somewhat problematic going from one to another. Here you are with your tile. Here you are with your carpet. Right? They both have purpose, but you have to be vigilant when you're going across the threshold. These, I don't know if you've noticed, but there are a couple people that got injured from trip hazards. Why? Because these carpets weren't taped down. If you go into civil right now, I'm pretty sure this is the case, you walk in that door over by the loading dock, what do you see with these carpets right now? Do you see this kind of thing? You see them, but is there something added to them? You probably never noticed. They're taped down. They're all taped down. Every night they pull them up, they're replaced, they're sent off, they're cleaned, they put a new one down, and they tape all those rugs down. It's a lot of extra work, but the problem has been that these things get bunched up, you tend to trip over them, and just imagine yourself, falling up against a door, hitting the glass, and so on. One thing could lead to another, could be in serious trouble. So they still put these out there because they make a difference in terms of tracking dirt in and out of a building, but now the way they do it is they tape them all down because too many people had slipped or tripped upon these rugs as they got bunched up. Physical conditions, health and physical conditions impairs a person's vision and judgment and balance. One of the things that I do here, I'll share with you, is that I avoid this campus as much as I can the week before finals and the week before school starts, because people are so distracted with so many other things on their mind in terms of getting checked in or getting themselves checked out in terms of prepping for finals and so on and so forth, that if you look at the police blotter, there are far more accidents, far more injuries, and so on and so forth, because people are completely, their mind is out of phase with the present, right? This situational awareness to whatever it is that their mind is occupied with, and that's where a lot of problems occur. So I just say if I can avoid campus, I try to do that, and if I do come to campus, I'm extremely cautious about getting around. So one of the things to be aware of, obviously, judgment is impaired, but also there are vision issues. Eyesight, the visual perception of things. Age is a factor. We're going to get into that a little bit later lecture with lighting. Your physical state and fatigue, that's another factor that comes in. Stress and illness. Medications. Alcohol, drug effects. That Breakfast Club thing, I always be careful about that too. And then, of course, blood sugar becomes a problem. How many of you are riding on that blood sugar fat roller coaster, right? Just having that thing go up and down, so we're pretty jacked up after we eat a bag of Fritos, that kind of thing, and then we start coming off the back end of that thing. This can affect our judgment right here, that blood sugar level. So try to get off that roller coaster. Excess junk food. It is everywhere. Profit margin. It'll be interesting to see what this Affordable Care Act comes into play, because insurance companies are going to be much more incentivized about talking about preventive health issues, and we're going to see probably some less of this stuff, especially government subsidies that really push all the corn subsidy hires a little bit higher, and find that the corn syrup and just about everything. But this kind of stuff here can also put you on a basic sugar high. And the problem is not going on the high, it's coming down on the back end, right, and leaving you tired and fatigued at the end. By the way, in terms of studying for exams, I don't know about you, but a lot of times in the day, I'd be studying for something, and I'd stick my head in the refrigerator about every 15, 20 minutes, right, looking for some kind of miracle to jump out at me, right, to say, oh, God, give me that sugar boost so I can get back and concentrate. Turns out people perform more poorly, the Harvard study that came out recently, who do that, who do the binge eating and go through and eat and get their sugar up and so on, and think that, okay, they feel better, but actually they're not concentrating as much as they would if they stayed away from it and drank more fluids. So I thought that was kind of interesting. So watch out for these machines. Human factors, increasing the risk of slips and falls. This is area going up and down stairs with boxes. That's definitely blocking your vision. You have to be so careful about that. So obstructing the view, impairing your balance, especially if contents might even shift around in the box too, also throwing off your balance. And then obviously handrails that are here. if you got your hands full right there. By the way, what kind of grip is this? Yay, it's fair, right? Because you get your hands about 90 degrees bent. Good for you. Okay, types of shoes. Here, metal taps on shoes. Well, you may sound like Bojangles, and be distracting, but it can result in more slips as a result of that. So if you're going to get those, I tend to go with the rubber ones just to keep my heels from wearing down. Leather shoes or smooth soles also can result in slips. And then the high heels or pumps that I talked a little bit earlier. Why? Because this is your walking surface right here. These are high impact points right here. They offer you no stability at all. So, of course, one of the reasons why these are fashionable is they basically throw everything off balance, right? By throwing everything off balance, it tightens everything up, which looks attractive, right? The problem is you pay a price for that, right, in terms of possible slips and falls, and certainly in the context of this. So it's something to keep in mind. So the mechanics behind walking is we have three forces. You'll be tested on this. You have friction force, normal force, supporting force, and shear forces. The ones that we're interested in here, the shear forces on the slips, the frictional forces, trips right here, and then, of course, the combination of the two right here, falls. So as we come down, we have our friction force here. We have our heel strike. That's our normal force coming down. Supporting force coming back up, giving us a sense of our walking. The shear force is going forward. So if we have low coefficient of friction, what's going to happen? We'll have a slip, right? We have a high coefficient of friction, what's going to happen? Just the opposite, right? A trip. So this is what, actually, if you had a force gauge, by the way, Jim Barney, who was over industrial engineering, passed away last year. What a magnificent guy. He worked right up until he passed away, and he was in his 90s. He invented the force plate, which is kind of cool, right here at Purdue University. All the stuff that you see related to force plates came from him, which is kind of cool. Anyways, this force, as you can see, as a person's walking along, and this is your time element. This is your heel strike right here, and this is the push-off with your toe. So you can see that as you're walking along in terms of the pressure differential right here, coming in on these right here, the heel strike, high peak. So this is one of the reasons why when you see that there, and of course this one's a little more, I would say the profile is not as great as on the heel strike. What happens between the two is that you can see where if you had a low coefficient of friction with that high heel strike, where it's really easy, right, to lose your balance and slip. And when you're pushing off, if you have low coefficient of friction there, you could also have a force back, but it's not as much. So that when you get into the anatomy of slips and trips, and when you look at this profile right here, it shows you right there, this can be problematic. Why? Because the forces are high, but they're very short in time. So just like that, an instant. That's why a lot of people say, I was walking, and then bam, I was on my back. I had no idea, that was happening. That's because of this kind of profile right here. So one of my colleagues, when I was with the CDC, her name is Amy, went off with the American Firefighters Association, started working with them. But I asked if she would help me out in terms of walks, because she was always one to wear pumps or heels. And she liked being fashionable, so she always would park down here. And it had snowed that day. And I wanted to show you a series of pictures and here's her steps walking up and down. I didn't have to get human subjects on this, by the way. She consented. But if you can see the distance here in the strides marks, walking up versus coming down, they're smaller. First, we're going on a grade. She's on pumps, right? She's in pumps right now, coming down. I guess those are heels, aren't they? Pumps, high heels. But the idea is that she has that short contact area, so coming down, you're going to take shorter steps because you are worried about the slip, right, on the snow. But walking up, what's happening is that you actually open up your gait a little bit more because it gives you a little more traction in terms of moving up the hill, not shorter. It's kind of interesting when you get a profile of steps like this. And here she is walking up, coming down, and pushing off. And of course, the idea here is as she's pushing off, she had a good grip, but she has to have contact with her other foot in order to hit the surface and moving along. And this is that classic profile that I just showed you on the force plate. And this is a better view, an angle of her walking uphill. And notice that the heel strike coming down right here, but as she does, she nails it, and then she rocks forward. But notice she's got 2 points of contact here, 3 points here, and she comes down. Before she lifts her heel up here, that foot's going to go down, and then that point's going to come up. So she always has 3 points of contact in her walking in order to try to avoid. Why? Because she's being consciously aware, first of all, what I'm doing, but the fact that of a slip or a fall she's trying to, or a trip she's trying to avoid. So known contributors to injuries, obviously work surface characteristics, the floors being predominant, slippery floors, obstacles are a distant but significant second in the way. Okay? Changes in elevation, stairs, ladders, and ramps. Falls on stairs are a major hazard in the workplace, according to the Bureau of Labor Statistics, where people go on, especially if they're carrying objects in front of them. Floor selection and common factors, obviously, are cost, maintenance, load bearing, aesthetics. Ergonomic issues that come up are slip resistance, trip potentials, fatigue on the floors. The harder the floor, the quicker the fatigue that comes in. Shoe floor interfaces, interactions, and noise reduction all come into play. So many of you that might work in healthcare facilities and so on, all of these really come into play. So if you are thinking about a hospital and you want to look at issues of slips, trips, and falls, aesthetics, and costs, and so on, what is the most economical floor you can get with the greatest effectiveness? Anybody know? What's that? Carpet? Problem with carpet is that it may be a reservoir for spills, mold, fungus, things of that nature. Biohazards, right? Someone may have a leak, that kind of thing. But it's yeah, carpet's great because of noise. Carpet's great because it can be replaced because they now have carpet squares rather than rolling out the whole thing, which is kind of nice. Problem there with a lot of times with the glues and the off-gassing, that people get allergic to that. But there's always, wherever you have a solution, you always have a challenge. But that's a good stab. Anything else? Anyone else? Yes. Padding? Oh, rubber mats. Okay, you could put those out there. You can pull those up and clean them and so on. Yeah, those do work, especially in and out of thresholds, entrances, exits, that kind of thing. The quick answer, given time, is cork, using cork. And the cork basically gives you the give in terms of walking on it. It's cleanable. It's quiet because it absorbs noise. And it's fairly easy to replace because you can cut it out and put it back down and replace it, just like a carpet square. So a lot of hospitals now are going to cork because of all these things that come into play. And aesthetically, because of the technology has gotten better and better, these things, a lot of times you look at them, you don't even know they're cork. But they are. Are you ready? Here we go. I still want to have time to talk to the other students. Here we go. So this is kind of a big deal. This cumulative trauma. This is important as the biomechanics side of the lectures that I had, and we're just basically now we're looking at the upper limbs. The things that we do up here. This has a lot more to do with repetitive motion and force and posture and so on. I'll go over the top 7 with you. Whereas when we dealt with the back, it was all about forces, right? And then the biomechanical model in terms of cost for frequency of lifting and so on. But this gets more into the finer modes of manipulation, and the risk factors shift a little bit, where you now have to manage about 7 basic risk factors. The other one, we're really only managing a couple, right, in terms of biomechanics and physiology. So read up on this. I might have the wrong, I believe that's right? Is it chapter 8 or is it 32? Thank you for that. I'm sorry, I apologize. The 32? Okay, chapter 32. Sorry about that. It's old version, new version stuff. So I want to provide a brief introduction, work-related CTDs, and then go through these exercises to talk about different common types of work-related CTDs and the 7 basic risk factors, and then know how to prevent them. So to start out, We have musculoskeletal disorders, the back. We have things like carpal tunnel syndrome, tendinitis and tenosynovitis. Whenever you see a thing that says an itis in it, what does that mean? Inflammation, right? Excellent. And we have arthritis, right? Some people, have those kinds of issues coming up. Vibration-related disorders. They're segmental in whole body. In this case, because we're talking about the upper limbs, we're talking about segmental. And things they call white finger or Raynaud's phenomenon, because there's also a syndrome up there. This is Raynaud's phenomenon on white finger. Cardiovascular issues, myocardial infarction, stroke, hypertension, dermatology issues, dermatosis, burns, and so on, and other disorders such as hearing loss, psychological impairment, and so on. But you remember from my talk when I was trying to make the case for ergonomics, why would that be of any interest to you in terms of how you would use it in your occupation? Why did it come out to be important relative to these others right here? Because it is the number one thing that causes restriction in work activity, right? It's a big cost factor, and it's a thing that employers do see, and it hits the bottom line. So remember that. So remember I talked about strains and sprains? Here we go. Here's your strain. Probably should go back to my red thing again. Of course, it'll change next slide on me. There's our strain. There's our sprain. And our strain, then, is we're looking at a muscle, ligament, or tendon insertion strained when it is pulled or pushed to its extreme. A sprain, a ligament, is sprained when it is stretched so far that some of its fibers are torn. You will see that again. Okay, just know that difference between. So I mean, probably most of you do that already, but just to make sure that when you say, well, what's the difference between a strain or a sprain? Now you know. Then we have others, the tendinitis and their definitions. Inflammation of the tendon, tenosynovitis, inflammation of the tendon, synovial membrane, ganglionic cyst. These are also called Bible bumps. These are back in the day. If you grew up in a Catholic system, the nuns would run around if you were acting up, and they'd whack you on the back of the wrist to get your attention. See, I'm not so bad, right? And what would happen is a cyst would form around the tendon. And then what they would do is they'd come around with the Bible again, and as it formed, and they'd whack it again, and they'd pop it. And just very painful. A lot of scar tissue there can result. But anyways, these are ganglionic cysts. Overuse. Bursitis. This is inflammation of the bursa, right? This is basically to help you move in your various joints around the body. The shoulder, for example, is notorious for inflammation of the bursa. Myositis, inflammation of the muscle. In arthritis, of course, we know about that. It comes from arthron, meaning the joint, and inflammation of that particular joint. This is a schematic of the tendons in the hand going down the synovial sheaths. So I like to look at this kind of like a bicycle cable, right? That protective sheath around the bicycle cable allows it to slide back and forth. When the tendon becomes inflamed, or the synovial sheath, or both, the resistance is much greater, and it's very painful to be able to move it around. Notice on the back, you have the extensor retinaculum right on the front, and on the front, or on the inside of the wrist, medial side, you also have a transverse ligament right here, and this is what keeps everything together with regard to your tendons and nerves and blood vessels and so on. And a lot of times when people get carpal tunnel syndrome, what they do is they snip that transverse ligament, and it's just like loosening your belt after a big turkey dinner or something like that. It feels good, but you've lost stability, right? So that's one of the things about having this kind of surgery you have to be very careful about. So this band goes all the way around the wrist and stabilizes movement and function. Here we have a nice close-up of the synovial sheath and the muscle passing through and the tendon. And then this is a cross-section showing all the nerves now passing through the shoulder complex right here. And this is the radial, ulnar, and medial nerves. So highlight that because there are differences, and I'm going to test you on giving me what's called a differential diagnosis. Really important between, let's say, someone who comes up to you and says, I have tingling and numbness in my hand, and the idea is that you can discern the difference between a radial nerve issue or a medial nerve issue based upon the description of the symptoms. which, you know, it's really kind of cool when you think about it. Part of the problem is up here, these nerves, as you can see, they're passing through the shoulder complex. So any kind of movements up high like this, or reaching back, extreme motions, or reaching forward like this, bends it around the shoulder complex right here and the clavicle. And what happens is that if you do this enough times, it starts to impact on those nerves, and you get symptoms in the hands. The problem is that the origin of it is here, not in the hand or wrist. Yet most surgeons, if they don't ask you enough questions, they'll go right in here, they'll snip that transverse ligament, say you're good to go, and you go back and say, no, you didn't fix it at all. I said, well, what is it you do for a living? Well, I say, I do a lot of this and a lot of this and a lot of this. And I said, oops, you know, we did the wrong thing, right? Because the problem was originally